While primary care organizations continue to educate policymakers, physicians, and the public about the patient-centered medical home concept, a group of family physicians in suburban Plano, Texas have taken the model to the next level. Legacy Medical Village offers patients a one-stop shopping experience for a wide variety of commonly needed outpatient medical services, all available in one convenient location. The 100,000 square foot facility makes it possible for patients to receive prompt and open access and fully coordinated health care from their primary care physician through a host of clinics and specialists. The venture is anchored by Village Health Partners, an award-winning primary care group led by family physician Christopher Crow, MD, MBA.
The way traditional healthcare has been set up in America is based around hospitals, okay, which I fundamentally agree is the 180-degree difference of the way we should have set it up. And what I talk about is a pyramid, with the primary care is the foundation, and then the hospital is the tip. So it's 180 degrees from where it is now. It puts primary care in the control of the foundation, invest in it, and then what primary care physicians need for their patients is the next layer of the pyramid. Imaging services, therapy services, of course lab services, common specialties like cardiologists for heart disease that needs to be screened for, the GI doctors that are doing the colon screening, certainly musculoskeletal because we have injuries. And then you get into the next level, the ear doctors, the eye doctors, and you work your way up into the tertiary. So you start primary as the foundation and tertiary at the top.
Crow and his partners designed Legacy Medical Village with access to care, quality, and patient convenience at the core of every decision. It didn't take long for their selected subspecialists to move in.
Think about the 50-year-old smoking female that needs a chest x-ray, lab result, labs done, pap smear, mammogram, bone density, and a colon screening because she turned 50. How many visits would that take to different healthcare providers to get that done? Over how many days away from her work or home? In Legacy Medical Village, you come in, you see your doctor, you get your checkup and your pap smear and your blood work taken. You run downstairs and you get your mammogram and bone density done and your chest x-ray, and you go across the hall and get your colon screened for whenever you can have a driver. And you're back at work before noon. Okay, what was the time savings on that to that individual person or the company that employs them?
By bringing such a complete menu of services together under one roof, Legacy Medical Village is able to provide prompt care at a fraction of the cost of a traditional hospital or emergency room visit. Additionally, Dr. Crow has seen increases in patient compliance and patient outcomes.
What we've seen is the compliance of referrals for important things like mammograms and colonoscopies go way, way up because as soon as they leave our office, they can go right across the hall or right downstairs and get those done. And we make sure those services are open access too, so they're not having to always come back 3 weeks later for that appointment, which again would lead to non-compliance. Therefore, we have some of the highest rates in the country when it comes to those preventive measures.
The key to Legacy's unparalleled success is its business approach to practicing medicine. At the heart of that is a robust electronic medical record system that the group utilizes to the max, not just in their practice, but throughout the entire medical village.
When things are automated, your error rates go down too. Think of the last time you went to the bank to cash a check. It doesn't happen anymore. They invested in technologies that paid for themselves, that gives a return to their business, and it's a better service to the patient. I'd much rather go to an ATM near me than have to drive to the bank.
The commitment to technology and investment in the expertise to utilize it is one reason Village Health Partners has been able to create a new culture of business and practice within primary care. It operates more efficiently with nearly half the staff of the average family practice. Its physicians and staff do better financially, and patients are happier and healthier.
Our patients really love it. I mean, they really can't believe it because their paradigm of this country is to wait forever for your labs if you get called back at all, to wait for your doctor, to not get in the same day you want to get in, and to never be able to talk to your doctor. So when they come to us and all of a sudden we're saying, hey, we're going to just send this prescription straight over to your pharmacy, you can go pick it up, We'll have your lab results online for you to log in to see tomorrow with a note from us. Yeah, you can get in today because you're sick. It's really an unbelievable shock factor that they're getting into, because their past experiences anywhere else tell them that this is not possible. But when they see it in person, they're just not only shocked but very much appreciative, and the common theme is, why don't all doctors do this? And I always say, I don't know, they should.
Village Health Partners and the Legacy Medical Village, proving that the patient-centered medical home is not only a good concept, but if done correctly, could also be the bright tomorrow for American healthcare.